Today, as you've heard, it is with a heavy heart that we announce the greatest number of deaths in a 24-hour period, with 125 lives lost. That brings our total of lives lost to COVID to 1,072. We also had new cases, new positive COVID cases in the sum of 1,140, which brings our total state count to 25,733. While these numbers are disheartening, I don't want people to despair. Instead, I want them to renew our collective resolve to do what is needed to end the pandemic. We continue to learn and amass new information about this virus every single day. Remember, we have only known about this virus in the last 5 months, and we've only known it to be in our state for 4 months. So we're following the research and we're following the studies that come out daily to update our knowledge base and inform our decisions. New research suggests that people with coronavirus may be most contagious the day they start symptoms or even a day or two before. An article recently published in Nature Medicine yesterday indicates that a person had the highest viral load at the time of symptom onset. Of course, with the highest viral load, that would be the time of most contagiousness. Secondary cases were infected during index cases pre-symptomatic stage. So that means they identified individuals who were infected by someone before they actually had symptoms. This is why widespread testing is so important. We need to know who may be infected as soon as we can before they come into contact with many other people, especially the most vulnerable. As you're starting to understand, there are several types of testing. There's the virologic test that detects the virus. And these specimens can be collected with a nasal swab or a nasopharyngeal swab. The nasal swab would just go early into the nose, but the nasopharyngeal swab will go deeper down towards the back of your throat. And that one uses a healthcare provider to help collect the specimens. The nasal swab can be self-collected. These are point-in-time tests. If you don't have the virus, if you're not shedding the virus at this time, then your test will not be positive. But that doesn't mean if you have a negative test that you're immune or that you can't get infected. Please understand that even a day later, you could now take the same test and now become positive. There's also the antibody tests. These serologic tests focused on the antibodies that are made by your immune system. These will be important to know who has antibodies and who doesn't as we try to reopen the state. We are working hard to evaluate the tests for immunity that are coming online so that the very best of these tests will be offered here in our state. We are working with healthcare systems, universities, as well as ramping up our capacity at IDPH to run the virologic tests. We will need to know both who has the virus now as well as who has had the virus in the past. You could have immunity because you were previously infected, maybe you even were tested and were laboratory confirmed, but there are many people who don't have laboratory confirmed disease but had an illness and would also have developed antibodies as well. Until we have a vaccine, testing is the key to obtaining the health information necessary to help prevent the spread, as well as to help us safely reopen the state and return to work. You have heard me say it before, this is a marathon. We have to keep pace. We can't get ahead of ourselves. You can see that we still have many new cases and unfortunately many lives that continue to be lost. But running together, we will still beat this COVID-19. We are on the right track. We are not over this, but we will. Please continue to be all in Illinois.